Hey guys, it's Dr. Justin Marcajani here. Today's video is going to be about insulin resistance in females. We're going to talk about how insulin can affect female hormones, the side effects, and what we need to do to fix it. And before we do, make sure you click below, put your comments below about what your experience with insulin resistance is. Also, make sure you smash that like button. Really helps the YouTube algorithm. And make sure you hit that bell so you get notifications and subscribe so you get good content coming your way. All right, so off the bat, insulin resistance. So we have insulin resistance like we do like in type 2 diabetes. Type 1 diabetes is the insulin is no longer produced by the pancreas, by the beta cells. Insulin resistance is the receptor site. So if here's a hormone, it has to bind to a receptor site to work. If this receptor site gets numb and down regulates, essentially you need more insulin. So if here's the hormone, here's receptor site, and then it comes in. Now we need way more hormone to come in to have the same effect because the receptor site's getting numb. It's down regulating, okay? And so what happens is to have that same effect, we need more insulin. Now the problem is it's not a win-win. High amounts of insulin can create cellular growth. They can increase adiposity, increase fat cell growth. High levels of insulin in men, you'll see something called aromatase upregulated, where men's hormones, testosterone, goes downstream to estrogen and female hormones. Now in women, it's a little bit different. We upregulate an enzyme called 1720 lyase, which converts the estrogens into testosterone. So this is not good. Now, side benefit, woman's libido may go up, right? That's one side benefit, but you're going to have more androgens, which can mean more hair growth. It can mean more oil from the sebaceous gland, so more acne and cystic growth. It can also dysregulate prolactin, and prolactin can throw off LH and the whole female hormone cycle. So you can start to have a dysregulated hormone cycle. And then you can also start to grow ovarian cyst, okay? This is called Polycystic Ovarian Syndrome, PCOS for short. And ovarian cyst it's one of the major causes of infertility. So if we have a lot of insulin resistance followed by inflammation, because people that tend to eat a whole bunch of junky carbohydrates and acellular carbs and too much grains and too much sugar and alcohol or soft drinks, these foods don't just provide sugar that cause more insulin, that cause the receptor sites to downregulate. These foods inherently are inflammatory. So the more inflammation we have, that can dysregulate hormones as well, right? Because that causes more cortisol, and then that cortisol can create the need to pull progesterone downstream to make more cortisol. So it's definitely interesting when you have these hormonal issues and you have one thing start to go, that domino can affect so many other things. So in my Thyroid Reset book, I talk about it, just was writing the other day, hormones function and dysfunction together. It's very rare you just have one hormonal issue and it's isolated only in that one area. It does not affect other areas. So high levels of insulin can drive androgen issues in females. It can throw off prolactin. Prolactin can then throw off the FSH and LH signaling, which can then throw off the ovaries from making adequate levels of progesterone and estrogen. And then, of course, we start to grow ovarian cysts, and those ovarian cysts can create their own issues. They can create a lot of pain, painful periods, and they also can dysregulate ovulation and fertility. One of the major causes of infertility is PCOS. Now, how do you find PCOS? You may see elevations in your free testosterone, free and or total testosterone. That's number one. You may see ovarian cysts. So if you go for your annual exam with your gynecologist, they may do a transvaginal ultrasound. They put an ultrasound probe into the vaginal area. They'll look and they'll be able to see if they can see cyst. So that's another one right there. Also, extreme pain on your periods, especially in the ovary area. That could be another sign as well. And then high levels of insulin. So when we see high levels of insulin, it could be greater than 10, fasting insulin. I'm not sure what conventional medicine uses as a metric. That's what I use. Sometimes they'll do an oral glucose tolerance test where they'll give you a 75-gram drink of glucose. They'll measure your blood sugar and insulin at fasting, and then every 30 minutes or so, they'll test your glucose and insulin. And some women, their glucose goes up and it's normal and then goes back down. But then they'll run their insulin, and the insulin will be surging high to bring that glucose back down. Ideally, glucose is up and down, and insulin kind of follows a similar level. When insulin's having to overcompensate, right? Because remember, the cells are numb, right? That down regulation is happening. we start to see more. So there's two kinds of PCOS patients. There's the overweight woman who is just, they're insulin resistant. Remember, high amounts of insulin increase adiposity, increase fat cell growth, right? High levels of insulin, and they're having all of the PCOS, all of the androgens, all of those side effects, okay? Now, the other woman tends to be a little bit more petite, and these are what I call reactive hypoglycemic women. So their blood sugar is going up, but then it's crashing down. It's crashing down. They're still getting big surges of insulin, but their body is bringing that blood sugar down faster. So they tend to be on this roller coaster with their blood sugar, and this may cause irritability. This may cause mood swings, heart flutters, focus, energy crashes. So you tend to see it in the body comp. They tend to be more leaner, more petite, and they don't gain as much weight, but they're still surging a whole bunch of insulin. Just their glucose isn't staying chronically high over time, isn't on the higher side, and they may be actually more sensitive to insulin, so they may not be making a ton of it, but in a punctuated fashion, they're making a lot of it, and then it's coming back down once the blood sugar crashes. So those are the two kinds of people, and you're both going to see dysregulation in the cycle. You're going to see a lot of painful periods, back cramping, breast tenderness, maybe excessive bleeding. It's possible. All of these things are very possible. So you have the insulin resistant, high level of blood sugar that's staying chronically high, and more adiposity, more weight gain. That's female 1. Female 2 is usually leaner, more petite, or they may just be sarcopenic, right? Kind of very skinny, not a lot of muscle either though. Maybe more fat, not a lot of muscle, but they look more skinny petite, and they're just going up with their blood sugar and it's coming back down. They are a reactive hypoglycemic patient versus the higher blood sugar insulin resistant patient. Both are making more insulin. Again, both are dealing with similar situations. So you want to test for free testosterone. You want to look at fasting insulin. We want it below 10. Ideally below 5 is ideal. We want to look at all the female hormones. So in these patients, I'm running a Dutch Complete. I'm going to look at adrenals. I'm going to look at female hormones. I'm going to look at estrogen metabolism. I'm going to look at progesterone. I'm going to look at free and total testosterone. I'm going to look at insulin levels. And of course, we're going to look at their diet. And you can typically see, poor standard American diet, too much carbohydrates. And a lot of times you can see a lot of symptoms pre and post meals. Mood, energy, cognitive, and then you'll start to see hair growth and or skin issues follow as well. So I hope that helps. So in female hormone situations, those are my favorite because female hormones go off very easily and conventional medicine doesn't really have a lot of options. So you go to your conventional medical doctor, what are they going to do? Pretty standard. Birth control pill number 1, metformin 2, and then maybe spironolactone, which is a blood pressure medication they give to knock down androgens, and it can help with acne. So usually you're going to see the spironolactone if you have the androgens and the acne. You're going to see a birth control pill to smooth out the cycle, and then usually metformin or glucophage if there's a lot of insulin resistance. And that's typically it. No diet changes, nothing else. That's about it. Again, they may do an ultrasound to diagnose everything. So there's not many options. So when I'm working with patients, we're going to work on blood sugar. We're going to work on with diet. We're going to do certain nutrients to help sensitize the cells to insulin, right? B vitamins, chromium, myo-inositol, essential fatty acids. We're going to work on the adrenals. We're going to work on the female hormones. Inflammation plays a big role, and a big hidden source of inflammation is going to be the area of the gut. So leaky gut, gut permeability, gut infections, low stomach acid, not digesting protein, fats, and cholesterol adequately is a real root cause of why these things are happening. And again, not fixed by birth control pills, not fixed by metformin, glucophage, and not fixed by spironolactone, right? So we got to get to the root issue on what's happening. So if you want to reach out and work with myself, links down below, feel free to click and follow with myself and or my colleagues, and let me know your experience dealing with this. I mean, part of the reason why I've developed so much experience is because I've seen thousands of patients, and you have your foundational kind of clinical skills that you develop in school and in seminar, but then you apply it and then you learn. That's kind of how I've stacked on just doing thousands of patients. I've learned things that actually work. They aren't just in a book. A lot of times, clinical skills from books and classrooms is a minimal level of competency, and then you apply it and you practice, hence your practice, and then that's how you grow and get excellent results with patients. So hope you all enjoy that. This is a live video, so I will dive right into questions now. Let's see what we got. Nice, we got some questions here. Wonderful. Okay, Dr. J, how can one repopulate the guts after being on a low FODMAP diet long enough? So in my line, we have the 6 R's, right? Remove the bad foods. That's where maybe a low FODMAP diet comes in. Second R, replace enzymes, acids. So that's second. Third R, repair the gut lining and or the hormones. So those first 3 R's need to be addressed. Then we go to the 4th R, which is killing, removing the infections. 5th R is now repopulating good bacteria. 6th R, retesting. So if we back up, the 5th R is where we want to be focusing. So you have to make sure that you're working with someone and you go to those first 3 R's before you go to the 4th and 5th R. All right, I may skip some questions if they do not correlate with the topic of conversation today. All right, let me see here. What's the best time to take a female hormone Dutch test? So if you're a cycling woman, typically 19 to 22. If your cycle's all wonky and you're not sure, right, typically a 26 to 28 to 30-day cycle, usually 19 to 22 is fine. Right? 22 if you're a longer side, 19 if you're shorter side. If your cycle's all over the place, you can always just do an OPK test, buy a whole bunch of strips, pee on them. That tells you when your LH surges. That tells you when you're ovulating, and then you can complete the Dutch test 1 week later if you don't have a consistent cycle. Great question. What levels of testosterone would you look to say a woman in her 50s, my DHEA is normal, yet my testosterone is actually critically low, and I have to supplement with compounded testosterone cream daily? It depends. I would typically, if your DHEA is normal, I'd want to see how your adrenals are doing. I want to see how your DHEA would look on a Dutch test. I'd also want to look at your female hormones, but I would probably lean into a little bit more DHEA, and also some of your androgens can actually get kicked downstream from progesterone. I'd also be looking at your progesterone levels a little bit more to dial that in. So if you look at the hormonal cascade, progesterone, a little bit of that can trickle down as well. How would you go about getting enough protein and helping the guts if you don't want to feed cancer cells? I'm not worried about protein causing feeding cancer cells. The biggest reason why cancer is going to happen is high levels of insulin and refined carbohydrates. The bigger concern is not making glucose from protein consumption, right? That's gluconeogenesis. It's going to be from just consuming too much carbohydrates. If you're consuming whole food, real high quality proteins, you shouldn't have a problem. If you're doing lots and lots of protein powders, that may be a way you get in trouble. But if you're taking good fats with your protein, like if you're having some collagen protein with some coconut milk, right? And you're having some good fats, you need fatty acids to help metabolize and deal with amino acids. If not, you can, like they call it rabbit starvation when you eat rabbits up north, because there's literally no fat there. You need fatty acids to be able to process the protein. So as long as you're consuming protein with good quality fats and or whole food proteins, right? Like grass-fed cow, chicken, fish, egg yolks, right? Then you're typically covered. Good question though. Haven't received my insulin A1C results yet, but I've been low carb, low sugar for a few years, but I'm having some PCOS symptoms. Where should testosterone levels be? I don't have the exact number because they are different for men or women. With men, like a total testosterone is usually between 300 and 800, and I want to be in the top 25%. I'd probably want to be below, probably between the lower 25% and the upper 25%, probably in that mid-range for a female, and that's free testosterone. And again, it just depends on the lab, right? Sometimes LabCorp and Quest have different lab ranges. So as a percentile, probably in that top 25% to top 50%, probably not over top 25%. And again, your insulin level should be closer to 5. 2 to 5 is pretty good if you have issues, definitely under 7 though. Could prolonged sweating from wearing a lot of clothes for many years lead to hypoglycemia because the process of sweating uses up glucose? I wouldn't think so. I mean, if you're doing a lot of exercise and you're not refueling your body afterwards, could that create hypoglycemia? Sure, absolutely. Great questions. Could a varicocele testis cause low testosterone? It just depends. So varicocele is when a lot of the veins for the testicle, they drop into the scrotum, and you see like a lot of veininess in the scrotum. As long as there's no decreased blood flow being pinched to the testicle, as long as the blood flow to the testicle is adequate and the testicle is functioning well, you should be okay. You can get your testosterone levels checked, and if you're on the fence, you could always go see a urologist, and they could take a look at it, probably do an ultrasound on it to make sure blood flow is good. A lot of times there's like a hernia of those veins from the internal oblique, because the internal oblique muscle in your abdominals, that muscle actually goes on and grabs onto the testicle at the bottom, and a lot of those veins can drop into the testicle. It's like a little herniation in the testicle area. Sometimes patients will go in and have some of those veins cauterized, or I'm not sure if they can put mesh in, but there is procedures for that though. But as long as your hormone levels look good and your urologist gives it a thumbs up, which I think is good to assess, then I think you're set. Great questions, y'all. What levels of testosterone would you like to see a woman in her 50s be? I already answered that question. How would you go about getting enough protein and helping the gut if you don't want to feed cancer cells? I mean, just going to eat whole food protein sources a day. So a palm to a fist to a full hand of protein. And again, it depends on your metabolic needs. If you're sedentary, maybe a half a gram per pound of body weight. If you're more active, maybe a pound, 1 gram per pound of body weight. So if you're a 200-pound man, that could be 200 grams of protein, or maybe 100 to 120, right? The recommendation, I think, by the RDA is like 1.2 grams per kilogram, all right? So 1.2 grams per kilogram, and I'm pretty sure that's like a half a gram per pound, right? Because a kilogram is 2.2 pounds, right? So 2.2, or I should say, that was 1.2 divided by 2.2. Yeah, so they're doing 0.54, and I consider that to be a minimum. That's why I say like a half a gram per pound of body weight. That's like kind of the minimum. But if you're a little bit active, you should be at least at 3/4 gram per pound. And then if you're lifting weights and you're more active, definitely at 1 gram per pound. Adrenal supplements cause hair loss. Is that normal? Well, I mean, there's a lot of different adrenal supplements out there, so I need to know what the adrenal supplement is. Is it a nutrient, a hormone? Is it an herb? And is there any excipients in there? So that's really, 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 really important to figure out what the hormone is, what the nutrient is, and if there are any excipients in there. Hey, Casey, how we doing? Glad you're chiming in. Excellent. When's the best time of day to take probiotics with food? It depends on the probiotics. Spore-based probiotics tend to be better to be taken with food. But if you're doing like Bifidobacter, Lactobacillus, like your VSL3, like the more common antibiotics, the more common probiotics, if you will, in the morning on an empty stomach or before bed, empty stomach. And those are your Bifidobacter, your Lactobacillus, Acidophilus, all those good ones. With a male losing a lot of hair, has been low carb for a year, lost 30 pounds, energy gotten better, but prone to respiratory infections, seems libido is fine. What testing would you start? Got to look at the gut, got to look at a good high quality hormone and adrenal panel. All that's really helpful. So probiotics, empty stomach is ideal. Just FYI. There's some data saying you can do it with food too. You know, if you want to mix it up a little bit, that's cool too. But definitely coming off of like a gut clearing program, I'd want to do probiotics on an empty stomach just to have maximal repopulation, reinoculation with the gut, so none of the bacteria is going to be compromised by the acid in the tummy. Great questions though. I have a problem with lack of mucus in my throat and more in my gut tract. Do you know any supplement or medicines that increases mucus? Well, dairy and such will. Things that will help decrease mucus is actually N-acetylcysteine. But you have to figure out the root cause. Is it a food thing? Is it an environmental allergy thing? What's going on? So getting to the root cause is super, super important. Ashwagandha, holy basil, and other adaptogens causing the hair loss, but cortisol is very high. Have SIBO. Yeah, hard to say. If you have a lot of autoimmune stuff, it could be ramping up the immune system. You'd have to really look at getting the cortisol down. Maybe there's some thyroid stuff. You got to look at the whole picture. Outside of that, it's too hard to say if that's part of the issue, but you can always pull it out and add it back in later and see if that changes things. SARM, RAD 140 for increased testosterone. Yeah, that's a selective androgenic receptor modulator, right? Or agonist receptor modulator. So basically it dials up the volume on your testosterone receptor sites. Yeah, I've heard about things like that. There's another one called Somorlin that does that for growth hormone too. I like to keep it as natural as possible. So I'm not sure about the side effects on that. If that's a drug, I would just be concerned about the side effects and trying to keep it as natural as possible. So I don't have a ton of experience with the SARMs. I would like to be using things like Eleuthero. I'd like to be using things like zinc and Tongkat Ali and selenium. Like if you have low zinc or low selenium, that could be a big part of why your testosterone's low. It could be something else, low DHEA or adrenal stuff or a gut issue. So you got to look at the root cause on why your testosterone may be low. If increasing testosterone is a goal. Arginine increasing testosterone? Yeah, it can. Yep. Arginine, citrulline, those help increase blood flow, and that can definitely help a bit. Oh, you're welcome. Thanks. I wish there were hundreds of me too. Is it possible to die from a tobacco overdose? I mean, I don't know about that. Now, it's possible that you can get a ton more nicotine with these vaping devices because there's just a lot of nicotine coming in. So, just keeping it at what you would normally get from a single dose, I think, is typically fine. The problem with vaping is you got to be very careful you're not getting too much of that nicotine, and also you're not getting any of the preservatives. There's a lot of nasty preservatives in there, so you got to make sure you aren't getting any of like the polysorbate 80 or any propylene glycol or any like stabilizers like that. That's not good. All right, y'all. Great questions here today. Again, if you're a female, have androgen issues, PCOS, infertility, and you're not being helped by the conventional model, please feel free to click below. And if you guys enjoy the content, make sure you share with family and friends and put your comments. Have an awesome day. Take care, y'all. Bye.